a couple years ago and broke my ankle and have had a couple surgeries on it. I faced a lot of issues with swelling, difficulties going up and down stairs, range of motion, especially when it comes to squatting. So when I came to the KOREC clinic, those were the issues that I was facing. But since I've been coming and having treatment, my swelling has massively reduced to pretty much nothing. My range of motion has increased greatly through the home exercises that I've been assigned and coming to the clinic. Also, for the first time, I would say last night, that was the first time I was able to sleep through the whole night without having restless legs, which is a real issue. I usually wake up several times a night with restless legs. And currently I'm doing exercises in the clinic at home, and recently started with the kinesiology tape, which has been actually helpful. But yeah, overall very happy with the services and in a lot better position than I was when I first came.
Thank you. Lower end of the fibula. Then the patient went to the surgery. They put some metal plate over here in the fibula. You can see the scar. So after doing the surgery, there are a lot of range of motion got restricted in dorsiflexion. So due to the lack of range of motion, patient is not be able to do squat in a normal position. Patient is bending a lot in forward bending position. So what we are trying to do today, we are going to do muscle energy technique for gastrocnemius and soleus muscle. You have to press my hand and you have to apply at least 20% of your power. Okay? Relax. Okay. I'm going to push this direction. When I feel there is some restriction or barrier, I'm going to tell you to push my hand. Okay? Now push my hand and hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. When patient is going to relax, I'm going to do more dorsiflexion to increase the range of motion. Last time we're going to hold it for 20 seconds at least. Relax, 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 relax. Relax. So this is how we're going to perform muscle energy technique for gastrocnemius and soleus. Thank you. Good enough. Again, same thing. 10 second hold and relax. Again. Relax. Again. Max to max, you have to go a little bit forward to increase your dorsiflexion. Relax. Again. 10 second hold. So little bit over pressure, I'm gonna apply posterior direction pressure, and patient is going to perform that same movement.
Okay.
Start. Again. Relax.
I think it's better, I can't tell.
Again. Relax. Again. I'm going to push that direction, posterior direction, this movement.
Okay.
And you have to bend your ankle, ma'am. Dorsiflexion. Do it again, same thing. Yes. Relax, go back. Do it again. Relax. Do it again. Relax. Finger up. Yes, no, it's a little tough, I know. Toes towards the ceiling. Yep, maintain this position. Is it very tough for you?
Yeah, it's so hard. My ankles, I usually point my feet out a bit. So when I squat, so this is hard. Oh, I think I was trying to do it. toes are higher than they used to be though.
Keep your ankle like this, straight. No stretch in the ankle.
And stretch it?
No, no.
Or no?
You don't have to do anything. Then we have to stretch the step like 50%. And at the end, no stretch. To activate the glue, we have to rub a little bit. Anchoring point, no stretch. Move the strap, we have to take it out. Ankle, 50% stretch. And then no stretch. It looks like this.
So whenever a patient got a ankle strain or fracture, there will be some compensatory biomechanical pattern. Most of the injuries happen due to the imbalance of the strength of the ligaments. Medial side, we have deltoid ligament which is not allowing to invert. Lateral side, we have 3 ligament which is a little bit weaker than deltoid ligament, which allows the inversion. So with a inverted ankle, talus will invert, tibia will be externally rotate, which is leading to internally rotated femur. Due to this couple of movement or motion, as the ankle invert and plantar flexus, the fibula proximal end actually move posteriorly while the distal end moves anteriorly. So moving around further up to the body, leading to a posterior rotation of the hip on the same side, on that side of the injury, as well as forward torsion of the sacrum towards the same side. So if you strain your right ankle, you can expect right posterior rotation with a right sacral torsion. So with the fibula during inversion, as they invert and plantar flexus, the proximal aspect will move posteriorly while the distal end will move anteriorly. So when we are treating a patient, that time we have to do high velocity thrust technique for the proximal end of the fibula.